Hello, I'm Dr. Melton Guiberteau, a nuclear radiologist at St. Joseph Medical Center in Houston, and I would like to tell you about PET scans. The word PET stands for positron emission tomography. PET scans are a type of nuclear medicine examination which uses a very sensitive instrument called a PET camera to look inside the human body. A PET scan is performed using a small amount of radioactive drug which localizes in diseased tissue. The PET camera is used to detect these diseased areas. Most PET cameras are now combined with a CT scanner. This combination is called PetCT. While a PET scan can easily detect abnormal tissue, such as growing cancer cells, it does not precisely locate this tissue in the body. By obtaining a CT scan to define the anatomy of the body, the two scans can be fused together so that the diseased tissue is pinpointed in a patient. Together, the PET-CT scan gives an accurate snapshot of each patient's disease. PET scans can be used for a number of purposes, including the detection of heart and brain disease. But most commonly, PET-CT scans are done to evaluate patients diagnosed with cancer. PET has a unique way of finding cancer cells in the body. Cancer cells need more energy than normal cells, and they use sugar to get this energy. PET uses a type of radioactive sugar called glucose as a drug. The cancer cells use this sugar for energy, and the PET scanner is able to see the cancer by following the drug. In patients with cancer or suspected cancer, PET can answer important questions such as determining whether a mass is cancer or not, finding whether a cancer has spread in the body. It can also determine what kind of treatment would be most effective and assess whether that treatment is working or not and needs to be changed. PET can also find out if a cancer has come back after treatment. If you're having a PET scan, some preparation will be needed. You will usually be asked not to eat before the examination. If you are a diabetic, you may receive special instructions. You should wear comfortable clothing, and there may be other instructions as well. If you could be pregnant, you should inform the personnel before having the scan. A nuclear radiology technologist will perform the scan and guide you through the examination. To begin the PET-CT scan, a small amount of radioactive drug will be injected into a vein, usually in your arm. You will then be asked to rest quietly in a room with soft light for about an hour while the drug distributes itself in your body. This is very important so that areas of false drug concentration do not appear on the scan. Next, you will be taken to the scan room to lie on a narrow bed which is part of the scanner. The CT scan is performed first and takes less than a minute. Then, the PET scan is performed and takes about half an hour depending on the type of scanner. You must remain as still as possible during the scanning process. After completion of the scan, you will be removed from the scanner while a special computer is used to produce pictures of your body. If these appear of good quality, you will be allowed to go home or back to work. Once the images are complete, they will be carefully interpreted by a radiologist or nuclear medicine physician with special expertise in PET-CT. The radiologist's report of the scan results will be sent to your doctor and used to determine the best course of action for managing your care. PET scans can play a very important role in patients with cancer. I hope you have found this information interesting and useful. And thank you for visiting radiologyinfo.org.